Hello.
Hello, Anastasia. I was just writing to you. Good afternoon. How are you?
I'm fine. Thank you. How are you?
Very good too. Very good too. Okay, good morning. Well, good afternoon. Good morning, everybody. I don't know in which part of the world you're watching. Thank you very much. I see some names that I recognize. I see people from Lithuania, Dimokritos from Greece, Mohammed from Libya. So I'm very happy that you're here with us. Then Shalini, how are you? So today we will be having a very interesting webinar. We will be talking about the hair loss. It's a very interesting issue, and I think it's also very like a seasonal problem too. Now we're starting spring here in Europe. So all the temperature and everything is changing. So also our body is affected in a different way according to this changes of the weather. Also, I think that all of us were very affected with the stress and so on, which is also another thing that can impact a lot in our hair loss. So today, Dr. Anastasia Lapshina from Ukraine, aesthetic doctor and our key opinion leader, will be explaining in details how to treat successfully alopecia in the men and women, because of course, men and women, we can have different genesis of alopecia. So it's also very important the diagnosis of the doctor to use the correct product. Dr. Anastasia Lapshina will explain also about the importance of the home treatment, how to enhance the professional treatment at home as well. She is a professional working within aesthetic products for more than 10 years. So it's very interesting if you can write any type of questions you might have in the chat. We will be able to answer all the questions so when the webinar is finished. So I really, really hope that the webinar, that you will like the webinar. Of course, we are recording it for those that are not able to participate today, or if you want to rewatch it and share it with your teams or doctors. So welcome everybody. Anastasia, thank you so much for being with us. It's a great honor to be with you again online this time. But thank you very much for finding some time for this webinar. Welcome.
Thank you, Kati. Welcome, everyone. I'm also very happy to be today with you and to share some experience with you in the treatment of alopecia, to give you some more information, useful information about the range of inner aesthetic products that you can use for treatment of different kinds of alopecia. But before starting to talk about the products, about the protocols that we are going to use, it is very important to remember, to remind you maybe the structure of hair, because without understanding of the anatomy of hair, without understanding of the structure of hair, it is impossible to understand what kind of treatments we are going to use and how to be successful in treatment. So on this picture, you can see the structure of hair, and you can see that this is not just the part of the hair which we usually see, because this part which we usually see is the hair shaft, which is protruding from the skin. But this structure is supposed or is referred as to a dead structure. So actually, if we are going to use some cosmetic products, some balms, shampoos, and something like that, oils, for example, we will not influence the real whole structure of the hair. It will be just influence of the visible part of the hair, and of course the result that we will get will not last for a long time. So maybe it's more like a cosmetic influence, but not really the treatment. The most important structures of the hair are located deeply in the dermis, and here you can see the follicle, which is the structure in which the root of the hair, the bulb of the hair is located. Also into the follicle, the ducts of the sebaceous glands flow. Here also you can see nerves and blood vessels, which are responsible for the innervation. They are also responsible for the nutrition, for the oxygen, which will go to there and which will support the growth of the hair. So hair follicle is extremely important structure that we really can influence with the help of some ingredients, with the help of some products. Also, you can see here sebaceous glands, which are responsible for the synthesis of the sebum. And the more sebum will be synthesized in the sebaceous glands, the more oily skin of the scalp of the patient will be. Inside hair follicle, we can see a bulb, which is actually the most important structure of the hair, and actually this is a targeted area that we are going to influence. So all the ingredients, all the products which we are going to use are supposed to get inside the dermis, and that is why it is very important to use some kind of techniques, like, for example, mesotherapy technique, which gives us the opportunity to put active ingredients just to the targeted area, because with the help of the needle, we can put these ingredients to any kind of layer we are interested in. And also, if we are going to use some cosmetic products like hair lotion that we are going to discuss today, it is also important, it is crucial that these active ingredients will be able to get inside the dermis and to get to this targeted area, which is the bulb of the hair. So, one more time, hair shaft is a structure which is known to be dead. So there is no sense to try to influence this part of the hair. The most important structure for us is the bulb, which is really a living structure of the hair and which we really can influence with the help of some ingredients and products. Here are taking place all the main functions, all the main processes which is going with the hair. This is hormonal processes, immune processes, metabolic processes. So here is also the region where the cell division takes place. Also, you can pay attention to the structure of the hair bulb. It is also not so common, let's say. So it consists of different parts like medulla, cortex, hair sheath, matrix. Here also you can see that the melanocytes are located, which are responsible for the color of the hair. Not only the structure of the hair is important for us. Of course, we have to understand that hair is usually all the hair that we have in our head is in the different phases, in the different cycle of their growth. And in the normal condition, in the normal situation, 85% of the hair should be in the anagen phase, anagen cycle of the development. This is the cycle of the active hair growth. And actually, if it is really so, if 85% of the hair would be in the phase of the anagen, it means that everything is fine with the growing of the hair. We will not have the problem of the hair loss. We will not have the problem of alopecia. Usually the cycle of anagen is about 2-4 years for men and 3-6 years for women. This is a normal situation. Only 1% of the hair is in the cycle of the catagen. This cycle lasts for 3-4 weeks, and this is the process of the deconnection of the hair follicle of the hair from the place where they are supposed to grow. So this is like the last cycle of the development of the hair. Around 14-15% of the hair are usually in the phase of the telogen, and this phase usually lasts for around 3-4 months in normal situation, but in the situation of the alopecia, we will be talking that telogen fast will last more. Usually, if it lasts for around 6 months, we can talk about telogenic alopecia. And also, some part of the hair can be in the phase of the early anagen. So in this period, you still or not see some young hair, or they just start to be protruding from the skin. This is also a picture which just will help you to understand what is happening with the hair in the different cycle of their development. And let's go further, talking about the trichology and different kinds of the treatment which we can offer to our patients. So first of all, what is a trichology? We have to understand that this is a specific science about hair, and there are some peculiarities in this science. There are some peculiarities in the treatment of patients with trichological problems. I think that if you or if your doctors are working with trichological issues with their patients, you understand that this is really an issue for every kind of specialist, because such kind of treatments demands a lot of patience, demands some kind of discipline from your patient. This is not the treatment which can be done during 5 sessions and that's all. So sometimes this is really a long range of treatments. Sometimes we can say that this is a lifelong treatment, especially for androgenetic alopecia and especially for men. So during working with our trichological patients, what structures we are working with? This is not only hair. This is also the scalp of the patients, which we have to pay attention to, and we have to evaluate the quality of the skin. We have to evaluate the type of the skin. It is very important to see if the skin is dry or if it's oily. So today our main topic is alopecia. So mostly with the patients with alopecia, you will see that the scalp is oily. And a lot of patients will tell you that they have to wash their hair every day. For someone is even twice a day, because the synthesis of sebum is extremely active. So the sebaceous glands are producing a lot of sebum, and this is also can be connected with the high activity of the androgens. It can be connected with them, associated with the high activity of 5-alpha reductase. But about all these etiological factors, we will talk later. Also, while working with the patients, maybe first important step is to put a correct diagnosis. So without diagnosis, without understanding the reason of the hair loss, it is not possible to offer really very effective treatment. It is not possible to get some long-lasting results. That is why it is crucial to have really full consultation with your patient, not less than 20 minutes, while discussing about the probable reasons of the hair loss, about discussing of the main problems. Maybe it's not hair loss, maybe it's the quality of hair. It's crucial to ask the patient about his idea of etiology of the process. So sometimes patient by itself will tell the doctor that something happened, for example, 3-4 months before. It could be stress, it could be some illness, some disease, it could be fever, it could be some hormonal disbalance. And depending on these reasons, we would choose the best treatment we can offer. The main problems that patients usually face, talking about hair and trichology, are alopecia, which is increased hair loss, Also reduction in hair density, or for example, slowing down in the of the hair. This is not alopecia. This is why the long period of developing and growing of the hair, and some problems with the scalp, which can be dry skin of the scalp, extremely oily skin of the scalp, or for example, some rashes on the skin of the scalp. So there are different types of researches that we can do for such kind of patient. First of all, which I've already mentioned, is anamnesis, without questioning, without having the whole picture of what was happening with the patient and when it was happening. It's not possible to put the correct diagnosis. Also, we can do a pool test for our patient, and usually it helps us for the evaluation of the telogenic alopecia. Later, we will discuss how we will do it. This is also a trichogram, which is one of the most effective ways of the research and diagnostic, because it gives us the opportunity to have the pictures before and after. It gives us the opportunity to evaluate the quantity of the hair follicles, of the hair on 1 square centimeter. We can evaluate the situation and the condition of the scalp. And also, this is a good way to show the patients the result of the treatment, because for the patient, it's very difficult to evaluate if the treatment is really effective or no. Sometimes we need not less than 2 months, for example, to see some hair which is in the early phase of the anagen. So the patient will see that there are some young hair which are starting to grow. But before that, it is very difficult to evaluate. And when you are showing your patient pictures before and after, it really helps a lot. And of course, laboratory researches. So usually we need some blood test in order to evaluate the condition of the whole body, in order to understand there are some deficiencies of vitamins, of microelements, of macroelements, and so on. It will help us to understand, do we have to add some medical treatment, some medicine treatment to mesotherapy treatment, for example, which we are going to do for a patient. So first of all, talking about anamnesis, what we have to pay attention to. It is very important to ask the patient not what was happening a week ago, 2 weeks ago, but what was happening 3-4 months before. Because some patients do not understand that these circumstances, these diseases, for example, that took place a lot of time ago, really can influence the situation with their hair today. That is why we have to understand that actually something which was going on last week or 2 weeks ago didn't influence hair today. It will influence the hair in 3-4 months. So that is why we have to ask, did the patient have some kind of diseases, illness? Especially, it is very important to ask about COVID. And I'm sure that you have a lot of such patients which really had COVID in their anamnesis. And after that, they faced with the problem of the hair loss, and mostly it is considered that such a problem is associated with the rheology of the blood. Because of the lack of the microcirculation, these patients are starting to lose their hair in couple of months. Also, it is very important to pay attention to some hormonal disbalance. So we can ask about the period of pregnancy, we can ask about the period of lactation, for example. We can ask about chronic or acute stress of our patients. So, for example, if your patient is a young mother who has lack of sleep, or a person who is on a strict diet, for example, all these cases really can influence the structure of the hair, the quality of the hair, and can be the reason of the hair loss. After anamnesis, we need to evaluate. the structure of the hair. We also need to do our further tests that we were discussing, and we have to decide if this problem is androgenetic alopecia, or this is more common telegenic alopecia, and or this is just, it's not an alopecia, it's just some problem with the structure of the hair. Your patient doesn't like the how the hair is growing. For example, it's very slowly. They don't like the color of their hair. It's more grayish, it's dull, so on. It will help you to understand what kind of treatment you can offer to your patient. Again, the main diagnostic criteria which will help you to evaluate the results of your treatment would be using of trichoscope, because with the trichoscope you have very vivid picture which shows you what is happening with the scalp. It shows you what is happening with the hair, what kind of or what quantity of hair follicles do you have in some region. What is important, if you really have a trichoscope, then you have to evaluate the condition of the hair not only in one area. So as you know, there are areas which are which can be influenced with the androgens, and that areas which can be not influenced with the androgens. So mostly the area which is really can be influenced with the androgens is the parietal area, so in the middle of the head. That is why one of the point of your research has to be somewhere in the middle of the head in the parietal area, and the second point should be in the other area, for example, in the temple region or in the occipital region. And if you will see a significant difference between these areas, so for example, if you will notice the hair loss mainly in the middle of the head, in the parietal area, that will tell you that this is more likely androgenetic alopecia. If you can see hair loss in the different parts of the scalp and the different parts of the head, then most likely this is telegenic alopecia. What else I wanted to show you? Another diagnostic methods and information with which is important for us. So scalp type is very important for us because, as I've already mentioned, usually when we are working with the patient with some kind of alopecia, they will have oily scalp because of the overproduction of the sebum by the sebaceous glands. And this is actually the same problem which is happening with the patients with acne. That is why when you have patients with acne, for example, you can ask them, do they notice some changes with their hair, or do they have some problems with their hair, like hair loss or extremely oily skin of their head? And they will tell yes, because the process of the stimulation of the sebaceous glands by the androgens is not happening just on the face or just on the scalp. It is happening all over the body. That is why this is a common problem, and that is why these problems are usually associated. And the main reason is the hyperactivity of 5-alpha reductase, which is responsible for the transformation of the androgens into their active form, dihydrotestosterone, from testosterone to dihydrotestosterone. And then this active form of the testosterone will influence the development of the hair and will lead to the hair loss. So this is important. Usually when patients will tell you that they have, for example, dry skin, this is not the problem which will be associated with alopecia. This is the problem which will be associated with dandruff, for example, or some mycosis, or some dull hair, and so on. And usually the treatment would be completely different. So in this way, you have to use something antimycotic treatment. You can use something for the hydration of the scalp, but not the products which will regulate the activity of the sebaceous glands, not the products which will balance the activity of 5-alpha reductase and other enzymes. We have to evaluate the number of the healthy hair and the number of the thinning hair. We have to see, do we really have vellus hair on the scalp, which will tell us about androgenetic alopecia again. We have to understand and to evaluate different kinds of disorders of the mineral metabolism in the body, and for that we would need some blood test in order to see the level of the minerals and vitamins, for example. And sometimes we need the violation of the endocrine system. Sometimes we need consultations of the gynecologist. If you're talking about women, for example, especially if you think that this patient with the androgenetic alopecia maybe also has some polycystic ovarious syndrome, for example, then of course you will need additional consultation with the gynecologist. If you think, for example, that your patient is on a strict diet, or you are supposing that there are some ingredients which are not absorbing in the digestive tract, so here maybe you would need some help or consultation of gastroenterologist that will tell you what can be the reason of this malabsorption syndrome. Here you can see the main reasons of the hair loss. So I've already talked a little bit about them, but this is just a picture which will help you to understand what really we have to pay attention to. So strict diets and nutritional deficiencies. It means that during the consultation, you have to ask the patient, do they have any kind of strict diet? Are they going to lose their weight, for example? Because there are a lot of young girls who will tell you that, yes, they've noticed that they are starting to lose their hair after they decided to lose weight, after they started to be on some kind of a diet. And also it's crucial to ask your patient about a milk diet. So those ones who are using, who are taking a lot of milk, especially natural milk, who are taking a lot of yogurts and other milky products, this is also can be the reason of the hair loss, because the proteins of a cow, which we have in the milk, especially in the natural milk, are very similar with the proteins and with the hormones of the human body. That is why these hormones in the milk really can influence and can activate sebaceous glands. They can activate 5-alpha reductase, and in this case also we will have the problems of the losing of the hair. Dysbacteriosis, which can be the reason of the malabsorption syndrome. So in this case, you need the consultation of the gastroenterologist. Different digestive disorders also. This is the topic which can be discussed with the gastroenterologist. And diseases, the most important for us are anemia. So the level of the ferritin, which is lower than 40, or low level of the hemoglobin, for example, lower than 110, can tell you that this is the patient with anemia, and this patient needs some additional supplements during the treatment of the hair loss. Then we need information about hyper or hypothyroidism, because this is a gland which is responsible for different metabolic processes in our body, and while producing more or less hormones than it should be, we also can face the problem of hair loss. Insulin resistant, which is crucial. So those patients who have diabetes, they need additional consultation of the endocrinologist, which will maybe recommend some additional treatments. Increase in the androgens, sometimes you can notice it, sometimes no. So we have to understand that, yes, the increase in the level of the androgens is responsible for the hair loss. But it is very difficult to control the situation in men, for example. That is why also the result that we have in men patients, usually we see this result during the treatment and some period after the treatment. But if this patient will not use any kind of ingredients which will balance the activity of 5-alpha reductase, then again they will have the problems of hair loss. With women, if you suppose that this patient has the increase in the androgens, always we will need a consultation of the gynecologist, because in this case, more likely she will need additional treatment. Also autoimmune diseases, some cervical osteochondrosis and spasm of the scalp muscles can lead to the violation in the microcirculation, and usually lack of the microcirculation is like the first step in any kind of the problems which can happen with the hair. Let's come to the conclusion. What are the main reasons of the hair loss and how we can influence them? First of all, this is the decreased microcirculation. It means that hair or hair follicle doesn't get the necessary quantity of the nutrition, doesn't get oxygen, and in such a way we can have not only the problem of the hair loss, it will also lead to them very slow or slowing down of the growing of the hair. It will lead to not very good structure of the hair will be dull, and so on. So we have to work with the improvement of the microcirculation. We have to improve it. We have to strengthen the walls of the blood vessels. And that is why we will use the ingredients which can support microcirculation of the scalp. The next reason or symptom that you can notice is the excessive production of the sebum. And every time when you will notice that, it will tell you that here in this case we have to use the ingredients which will influence 5-alpha reductase and inactivate or balance the activity of 5-alpha reductase. Oxidative stress is also very important. That is why usually during the treatment of alopecia, we are going to use antioxidants, which will protect all the cells and membranes of the cells from the damage, which can be caused by free radicals, which is happening in our bodies every second. And lack of some nutrients. So there are some cases which we've already discussed that really the main reasons is the lack of some ingredients. So in this case, we have to use vitamins, we have to use minerals, which will be like both the building material for the hair and also the cofactors of the processes of the synthesis. Here you can see some information about stress and why it is so important to ask your patient about situations of stress, especially chronic stress, because we understand that there are situations with the acute stress and there are situations with the chronic stress. And acute stress is actually not a problem. It's a normal situation for everyone, and we usually have some kind of stress every day, but this is the situation when there would be the synthesis of adrenaline, and to tell the truth, this is not crucial for the growing of the hair, for the development of the hair, and so on. This is normal situation. But when we are talking about the chronic stress, the main hormone which is synthesized in this condition would be cortisol. And during the cortisol synthesis, during the activation of cortisol, it will lead to the slowing down of the growth of the hair. It will also lead to the lower quantity of the hair in the phase of the anagen, in the cycle of the anagen, and we will see the growing of the number of the hair in the phase of the telogen. And just one more time to remind you about the importance of the information about COVID. So I don't know, now after this pandemic started, maybe 70% of the patients who are coming with this or that trichological issue, they are the patient who had COVID in their anamnesis, and usually they will tell you that really they associate the problem with the COVID because before they didn't have the problem of the hair loss. So here in this situation, the main strategy of the treatment of the patient would be using of the ingredients that will improve microcirculation. First of all, improvement of the microcirculation in order to support scalp, in order to support bulk of the hair, to give all necessary nutrients, to give oxygen, to stimulate our growth factors. That will lead to the activation of process of the hair growth. Here you can see some tests which you can recommend to your patient to have before starting of treatment. That will help you to understand, do you need, for example, to use or to recommend to your patient to take some nutrients with iron, with zinc, for example, with vitamin D, and so on. These are the standard treatment from the androgenetic alopecia. You know that the main protocols will include using of minoxidil, finasteride, but today we are mostly going to talk about mesotherapy or combination of mesotherapy and PRP treatment. Here again, it is, if you are talking about PRP, if you are working with the platelet-rich plasma, then before starting to treat your patient, you have to evaluate the common condition of the body. Because if this is the person with a strict diet, after some kind of intoxication, after some kind of illness, then we have to understand that the treatment just with PRP will not be effective, because this is everything, PRP is everything that we are taking from our blood. If we have lack of iron, for example, then we have to understand that this treatment will not be really effective. So for such kind of patient, it's better or to combine PRP with some kind of mesotherapy. Like, for example, in the case of aesthetics, it could be hair vital, it could be hair loss control, it can be TIGF also, because TGF is the product which was formulated for the stimulation of the growth factors. So with such combination using PRP, you are injecting to the patient his own growth factors, and with TGF you are stimulating these growth factors. So this would be really a nice combination. And mesotherapy, we will discuss two main products that Aesthetics has in its portfolio. But the idea of mesotherapy and why it is so recommended for the patients with the alopecia, for both androgenetic and telogenic alopecia, is because mesotherapy gives you opportunity to work with the targeted area. You just need a needle and you will put active ingredients inside the dermis, and they will influence hair bulk. So let's discuss more precisely different types of the alopecia. And first one is androgenetic alopecia, which can be the problem not only for men. This is also can be a problem for women. For those women who have or higher level of androgens or higher activity of 5-alpha reductase. So what is the difference and what are the main peculiarities of the androgenetic alopecia? You can see that usually this kind of alopecia is taking place in a specific part of the scalp like in this picture, for example, this is mostly parietal area of the head. Sometimes in the case of men especially, it can start not from the middle, not from the parietal area, but from the frontal area of the head. This is also typical for androgenic alopecia. Also, with the doing, for example, trichoscopy, you can see the minimization of the hair follicles. You can see the smaller quantity of the hair which is growing from the one hair follicle. And of course, the main reason of androgenetic alopecia is the activation or high level of androgens, or higher activity of 5-alpha reductase, a specific enzyme which is responsible for the transformation of testosterone into its active form, dihydrotestosterone. While doing trichoscopy for men, for women, also what can you notice? So you will see hair follicle minimization, and also you can see vellus hair. So every time when you're seeing vellus hair, it will tell you that more likely this is androgenetic alopecia and not telegenic alopecia. Vellus hair is very thin hair. It's usually hyperpigmented, so it's more fair than the other hair. Of course, if your patient doesn't dye hair, for example, because if they are dyeing hair, you will not evaluate the color of the hair. Because of its thinning, usually vellus hair is growing horizontally, not vertically like normal healthy hair. You will see the dominance of the single units of the hair in the hair follicles, greasy or oily scalp, and of course pigmentation. So we have to evaluate the color of the pigmentation about the units. It can be yellowish, it can be brown, and these brown spots also will tell you that this is the case of the androgenic alopecia. I will show you now the picture, for example. So this is the picture of androgenic alopecia. You can see these yellow spots, and if you can see more than 4 or 5 yellow spots, this is unfortunately like third stage of the androgenetic alopecia. This is how you also can see it without trichoscope, just how you can evaluate that there is vellus hair. You can see areas where there is less of hair in comparison with the other parts. So this is how it's happening with androgenic alopecia. While starting, so once when the patient see the problem with the losing hair, usually this problem develops within 2-3 cycles. So with a year, patients will tell that the problem is like developing. They are not associating the hair loss with some specific season. Like, for example, some patients, when they are coming for a consultation, they are telling that yes, during let's say beginning of spring or during autumn, I have some kind of hair loss, but then it usually lasts for a couple of months, but then everything is fine. So this is not androgenetic alopecia. Androgenetic alopecia would be associated with the hair loss during all year round, without any kind of connection with the season. Telegenic hair loss is different, of course. So with the telegenic hair loss, the main reason is the shortened period of the anagen and more prolonged period of the telogen. Also, the quantity of the hair which are in the stage of the anagen would be less than 85%, and the percentage of the hair which are on the face of the telogen would be higher than 15%, for example. What will you notice during the trichoscopy with the patient with the telogen hair loss? So first of all, you will not notice vellus hair. Here you will see that all the hair are growing vertically. They have the same color, the same structure. You will see that the picture of the trichoscope, of the trichogram, is the same in the different parts of the hair. So usually it's not associated just with the parietal area, it's not starting from the frontal area. And the condition of the hair, let's say, is the same in the different parts. Also, during the trichoscope research, you will notice some empty hair follicles. So this is like the main differences between these two types of alopecia. Telogenic alopecia also can be acute and chronic. And to tell the truth, with the acute alopecia, even if you will not do anything, you will get good results. So actually, all of us are facing with some kind of seasonal alopecia, diffuse alopecia, telogenic, and this is during the spring, during autumn. This is normal. But if such kind of hair loss is longer than 3 months, then we will talk about chronic telogenic alopecia, and this chronic telogenic alopecia really need some kind of professional help. So it really demands some professional treatments like mesotherapy. It really demands some kind of professional home treatment in order to support and maintain the results which you've got in the clinic. So usually, again, this kind of alopecia, like chronic and acute, we have to evaluate during the first consultation and to understand what is the main reason. And of course, the strategy of treatment of anagenetic and telogen alopecia would be completely different. In the first case, with the anagenetic alopecia, we'll be talking that we have to influence hormones somehow, or we have to influence 5-alpha reductase somehow and work with the microcirculation. Here, with the telogen hair loss, we are not going to work with the hormones a lot. Our main strategy is to give nutrients, to give minerals, to give vitamins, to give some kind of stimulators of the growth factors like TGF, for example, is to improve microcirculation and to use such kind of ingredients that will strengthen the walls of the blood vessels. And with such kind of treatment, we will get really very good results. Very easy test, which you also can perform during the telogen alopecia, if you think that this is this kind of hair loss, is the pull test. It's very, very easy. You just have to grab from 50 to 60 hairs between your fingers, and you have to pull. If after this pulling, you will have like 10% of the hair, which is 5 or 6 hairs in your fingers. It means that, yes, this is the case of the hair loss. This is the case of telogenic alopecia, and this is the patient who really need treatment. So before talking about professional treatment with aesthetic products, there are also some common recommendations that you can give to your patient. You can recommend to do scalp massage, which obviously will improve microcirculation, and it's better to do from 5 to 10 minutes every day. This is the elimination of hypodynamia. This is also the recommendation which will help us to avoid some problems with the microcirculation. So yoga, stretching, general massage, everything will help us to improve microcirculation and to improve the access of the nutrients and oxygen to the hair follicles. Don't forget to remind your patient about water balance, to drink a lot of water, because without drinking water, there would be some problems with the rheology of the blood of such patients. So with drinking water, you also can see that the results of your treatments are much, much better. So now we are going to discuss aesthetic products, which first of all, we will inject. So this is the technique of treatment, which is recommended in this case is the mesotherapy. You can do it with the needle, you can do it with the dermapen, but the main idea is to put active ingredients to their targeted area. And usually this targeted area is inside the dermis, in the location of the hair follicle and hair bulb. First product which we will discuss is hair loss control. This is the formulation which helps to stimulate hair growth, which inhibit the activity of 5-alpha reductase. So mainly we are going to use it with the androgenic alopecia, but of course it doesn't mean that we will use this product only for men. This is a product both for men and women, but with the case of the androgenetic alopecia. The main ingredients which we have in these products, you can see here, these are fenugreek, capixyl, saw palmetto, azelaic acid, and pyridoxine and zinc. So what main effect that we are going to have after using of such kind of product? First of all, it contains capixyl, which is really an innovative ingredient. The function of capixyl is almost the same with the minoxidil, but this is the new formulation, more innovative, more active. So this is the biomimetic peptide, which has the possibility to decrease the level and the activity of 5-alpha reductase. And also it will stimulate the process of hair growth. Azelaic acid, pyridoxine, and zinc will help to reduce the concentration and to decrease the of 5-alpha reductase. So this is the inhibitor of 5-alpha reductase, and here is the explanation why it is so important to influence this specific enzyme in order to get a good result in the treatment of hair loss. Saw palmetto, which I'm sure you are familiar with these ingredients because it's very important, very famous, let's say. And maybe you've noticed it in the other products for hair treatment. And the main activity of this ingredient is also the inhibition of 5-alpha reductase. Treatment protocol. So again, you can choose any kind of technique you prefer. From my point of view, it's much more effective to work with the classic mesotherapy, with the syringe and with the needle, because with this treatment, you can put the product deeper, you can put bigger quantity of the product, comparing with, for example, dermapen, that will just give you some channels through which active ingredients will go deeply, but with dermapen, you don't have the opportunity like to do the storage depot of these products inside the dermis. Here you can see the video of the mesotherapy. It's very easy. you can, so mostly we inject it, not mostly, but all the time we have to inject it for the whole head, but you can inject more product in the area which are hormone dependent. So in the parietal area or in the area where evidently you can see the main hair loss, there you can inject more product. I don't recommend you to do very superficial papules. I don't recommend you to inject more than, for example, 0.03 milliliters into each papule, because this is always like the risk of the some kind of infication of this product. Not product of this papule, also during hair brushing, for example, or touching of the hair. If there would be big papules, then it will cause some hurting feelings. It will be a little bit painful for the patients, and of course we want to avoid any kind of infection in these areas. That is why I put the product more deeply. The depth is around 2 millimeters and the quantity 0.03 milliliters to every point of injection. Also, with this treatment, we recommend not less than 8-10 treatments. So you have to explain to your patient that it's not possible to work with the androgenic alopecia just during 5 treatments. Usually this is the longer process, and it lasts for around 2 months. So we can do treatments every week. The interval is 1 week. We usually use the whole vial for the head, and later I also will show you like the first step of the treatment, which during which we usually use Cenaroplast, and we are injected it in the area of the neck and back paravertebrally. The next product, which is recommended for the treatment of the hair loss and for telogenic alopecia, is Hair Vital. So again, this is not a product just only for women. This is a product for telogenic alopecia. So in the case when you're working with the patient who have some hair loss, seasonal hair loss, so during spring, during autumn, some hair loss after intoxication, let's say, so it's not associated with the androgens, then in this case you can use Hair Vital. Also, it's a great product for those patients who are telling that they don't like the quality of their hair. So the problem is not in the hair loss, it's just about the color of their hair, that it's dull. It's not like leave-in hair, so they want to support it, they want to give some nutrients and so on. So in this case, you can use Hair Vital. The main ingredients that we have here are amino acids, which actually the building materials for every kind of proteins, and also for the keratin, which is the main building structure of the hair. These are trace elements, enzymes, which are usually the cofactors of any kind of synthesis which we are going to stimulate, vitamins also as the cofactors of the processes, and peptides. So peptides would be responsible for the stimulation of the processes of the growing of the hair. Here you can see the amino acids, which are the main ingredients of the products. These are cysteine, arginine, methionine, and taurine. And it will help a lot for the patient who are on a strict diet, for example, who are not getting these amino acids from outside with the food, for example. So this is the way when you are injecting the main building materials for the hair, for all the hair structure inside the dermis. Trace elements and vitamins are the main cofactors of a lot of metabolic processes, and without using them, there is no sense to stimulate something. So we can use a lot of peptides for the stimulation, but if you don't have cofactors, if you don't have amino acids, you have nothing to stimulate. That is why it's extremely important that we have such kind of ingredients as the main ingredients of the formulation of the hair vital. Also adenosine, which significantly promotes the hair growth. This is like the stimulation of all the phases and stages of the growth of the hair. And the protocol of treatment is again the same. You can use any kind of technique you prefer. Just here I wanted to show you two different videos, one with classic mesotherapy and the other with dermapen. So it's possible if your patients are very sensitive, if they for them, for example, mesotherapy, classic mesotherapy treatment is painful, or if in your country you cannot use classic mesotherapy because of some limitations, let's say, then no problem. You can use it for dermapen, you can use it for any kind of microneedling. For the stimulation of the microcirculation, I can say that such kind of treatment even better than the classic mesotherapy because of the bigger quantity of the needles. So here, just with one touch, you can contact with the skin with 16 or 32 needles for every square centimeter. So for the stimulation of microcirculation, this is really very good option. But we have to understand that the quantity of the product for every point of injection is, of course, less than during the classic mesotherapy treatment. Usually we recommend again from 8 to 10 treatments, but in the case of seasonal hair loss, in the case of the supporting of the hair growth. So for example, sometimes it happens when you're working with a patient who do not have any kind of problems with the hair. So your patient is satisfied with the quality, he is satisfied with how it grows, everything is fine. They are just coming to you once or twice a year in order to support this growth, in order to support this quality. So in this case, 5 treatments would be completely enough for your patient. And again, the interval between the sessions would be 1 week. And this is the protocol which I was telling to you that I highly recommend to do not only injection into the scalp. Every time when I'm doing trichological treatment, I'm working also with the Senara Plus, which is the product for the stimulation of the microcirculation, for the drainage effect, and for the strengthening of the walls of the blood vessels. So these techniques give me opportunity to improve microcirculation in the whole body. And it's perfect if you can do it before every treatment, before every hair treatment. You just work with the back of the patient, and then she turns and you're working with the head. If it's painful, for example, for your patient, then you can inject just the area of the neck and at least half of the area of the back. As you can see, where I'm doing that in 2 lines from different sides of the vertebrum. And if you will start to do this step of treatment, believe me, you will have a lot of patients who will love this step. And I have a lot of patients with whom we started to do this step as like the part of treatment, of trichological treatment, of cellulitis treatment in order to improve microcirculation. But then these patients are coming just for this step because they feel the improvement in everything, improvement how they feel, improvement how they sleep. They have like those who have usually headaches in the morning. They say that it's better. They say that their cognitive functions are better. So this is really a great part of treatment, which improves the color of skin, which stimulates the nutrients or oxygen which will go to the cell and will nourish this cell. So I really highly recommend you to use Sinara in order to increase the result which you can get from hair vital and hair loss control, to maintain result which you can get from this product, and your patient will love it for sure. So these were the main products for the mesotherapy which we are using for the professional treatment. And also let's talk about hair lotion, which is the product for using at home. This is one of the best sellers of aesthetic derma products. Usually I recommend to every doctor to have it in clinic somewhere in the space where the patient can see it, because for example, if you will have some vitrina, for example, in the reception area, then always patients are interested in this product, both kind of patients. So those who have any kind of problems with the hair, those who don't have these problems with the hair, but everyone want to maintain the growth of the hair, to support the growing of the hair, and so on. So that is why this is one of the best sellers always. Hair lotion is the product which contains again that ingredients which we have been already discussed, and even more. And of course, the concentration of these active ingredients is higher than in the products for mesotherapy, because this is for topical use. And also one of the advantage of the product is not only its active ingredients, but GPS system. I just will show you the slide and then we will come back for the active ingredient. Okay. So don't forget that hair lotion, as any product of derma, contains active ingredient which is called GPS technology. So this is the technology which is responsible for this is guide performance system, which is responsible for the targeting of the active ingredients to the area where they have to stimulate some kind of processes. So having this kind of technology, like active ingredient of this product, we are sure that all these active ingredients like niacinamide, caffeine, all the peptides that we have in the hair lotion, they will not just stay on the surface of the skin, they will go deeper. So this is like a specific type of the encapsulation of any kind of active molecule in order to lead this active molecule to the targeted area. So once again, active ingredients that we have here are curcuma longa, which is the ingredient which prevents and reduces hair loss, and also it stimulates the growing processes of the hair. The composition which you are common with is azelaic acid and zinc, which are very effective inhibitors of the 5-alpha reductase, and peptides. So these specific peptides will work in a very short way. I'm sure that those of you who've already used the product, you know that it works extremely fast. So sometimes you're just given this lotion to the patient, and in 1 week, not in one, but maybe in 2 weeks, your patients will tell you that they already see that they are losing less hair. So this very like fast effect is because of the peptides, because peptides are very specific molecules which can stimulate or which can block some kind of reaction or processes in a very, very short period. So that is why the peptides which we have here, they are responsible for the inhibition of the 5-alpha reductase. They are also they are responsible for the decreasing of the pro-inflammatory cytokines, and they will, in such a way, they will stimulate the growing of the hair and the development of the hair follicles. Caffeine and niacinamide are the ingredients which are responsible for the antioxidant activity, for the stimulation of the microcirculation, and again for the inhibition of the 5-alpha reductase. And one more product which you can recommend to your patient for the combined treatment is Inhaderma hair cups. So these are the nutrients which were formulated specifically for the patients with the hair loss, with the and for both, for androgenic hair loss, for telogenic hair loss. Here you can see again the active ingredients which we have here, and of course then their main functions would be the same as the functions of the main ingredients of the mesotherapy products and hair lotion. So this is inhibition of 5-alpha reductase, this is nutrition, this is stimulation of the growth factors, this is improvement of the microcirculation, and also some vitamins and trace elements which are the cofactors of the processes of the synthesis. It is recommended to take 2 tablets per day. You can do it just 2 tablets in the morning, or you can divide them and take 1 in the morning and 1 during the day with the food. And the minimum period during it is recommended to take this these hair cups is 2 months. But to tell the truth, I usually tell to the patient that it's not less than 4 months, because to have a full result, especially in the case of the chronic telogenic alopecia, in the case of androgenic alopecia, it should be not less than 4 months. And in this case, you will see very good results. If we are talking about men with androgenetic alopecia, then we have to understand and we have to explain to the patients that they have to use hair lotion and that they have to take hair cups lifelong, because during intake, during using of these products, they will have very good results, because they will have the effects of the inhibition of the 5-alpha reductase, inhibition of the activity of the androgen. As soon as these men will stop using these products, the level of 5-alpha reductase will be higher, androgens will be activated again, and they will influence hair follicles. So again, they will have this problem. So in order to support the result which you've already got in the clinic during the professional treatment, recommend these patients to use lotion and hair cups. So here you can see some results which you can have and which was get during using hair loss control. Before, after 4 sessions, after 8 sessions. This was the using of the hair loss control, and you can see that really we have this patient have very good result of the stimulation of hair growth. Here you can see what is happening during the trichogram with such kind of a patient, and evaluate the hair is not so thin. You can see that the quantity of the yellow spots is much lower. The diameter of the hair is bigger, so the results are really very good. Here is also the result of the using of hair loss, and what we can see during the trichoscope research. So this was like the main information about the products for the treatment of hair loss control. If you have any kind of questions, and you can write them in the chat.
Yes, I'm checking for a moment. We don't have any questions.
If you will have some kind of questions, maybe after, then every time you can send it to your distributor, for example, which will contact with us.
Correct.
Or if you're a distributor, you can send it directly to Aesthetics. You can ask something, I don't know, on Instagram if it's comfortable for you. So it's not a problem. We will be glad to answer all your questions.
Okay, so I think we will need to wait for the questions and we will receive them later in emails or, as you said, in Instagram, maybe. So, is hair lotion as effective as minoxidil? It's the question from Dr.
Yes,
Sylvia.
so actually we were talking about Capixil, which is a biomimetic peptide, which is innovative, not form of minoxidil, but which is minoxidil-like peptide. So it is as effective as minoxidil. There are some clinical trials and there are some publications which show that sometimes it works even faster. It gives results faster than minoxidil or aminoxidil, which are actually the same ingredient but with a different names, commercial name, and the name of active ingredient by itself. So yes, the complex of peptides that we have in the hair lotion is as active as minoxidil. Also, you have this ingredient in the hair loss control. And these results of the hair loss control are also because of the combination of these biomimetic peptides.
Mm-hmm. Okay, so thank you very much, everybody, for connecting today. Oh, now we have some more questions, let's say.
Yeah, we usually.
Okay. Yeah, that's great. That's great. That's great. No, this is fantastic. Okay.
People are thinking about what they.
Okay, good evening, doctor. How about if the patient want to continue the injection treatment until 12 times, can or cannot have any negative side effect if we continue?
No, you will not get any side effects. It's great if your patient want to do it. You just not all the patients want to come to you every week for 12-15 sessions. That is why if it's okay for the patient, then perfect, you can do it. You will never get any kind of side effects. But if it's a very intensive treatment, let's say for your patient, then after 8 session, you can ask them to come not every week, but once in 2 weeks. So this is usually what we call maintenance treatment or supportive treatment. So it's fine, you'll not get any problems. What's the best
depth of needles to combine with the treatment?
To combine with the treatment. So the best depth of the needle is around 1 or 2 millimeters. So usually this is micropapule technique or point by point technique. I usually do not use nappage technique or superficial nappage technique because I'm thinking that in the area of the scalp we are losing some part of the product. So if you want to do the treatment very quickly, then better to use dermapen or any kind of microneedling from my point of view. Is there an objective way of assessing that the described hair loss program is working other than by just eyeballing the hair? So yes, we're discussing that you can do trichogram, you can use trichoscope. During such kind of research, you have very vivid pictures which can show you the picture before and after. And you can show this picture to your patient. So these would be the pictures like I've showed you at the end of the presentation. And of course, it will help you to evaluate the result. Without that, I agree, it is really not so easy to see the difference, especially at the beginning of the treatment. This is also, by the way, important point to explain to your patient that they shouldn't wait for the result during the first, second, or third week. Hair will not grow so quickly. Sometimes during the beginning of the treatment, during first several sessions, your patients will tell you that they are losing more hair. This is also a normal situation because you are stimulating hair in every stage of their development. So those hair who were in the phase or in the stage of the catagen, let's say, they will, your patient will lose them even more quickly. So, but usually this can happen during around 2 weeks, and then patients will notice that they are losing less hair than before.
Can we do this management yearly, even if we do not have problems as a protection?
As a protection, of course, we can do it every year. Better to do it twice a year, and I recommend to do it during spring and during autumn, because these are the main seasons of the telogen hair loss. So it can be acute hair loss, which is not a problem, and even without your support, everything will be fine. But if you are going to support, if your patient is interested in the supporting of the treatment, then yes, twice a year you can do it during the seasons, no problem.
Okay, and anesthesia, yeah, if the anesthesia is needed.
Yeah, so talking about anesthetics, I never use it. It's possible to use it, but of course for anesthetics you need to use spray. I hope you understand that it's not possible to use some kind of cream for the scalp. It can be spray, but remember that the main problem, the main issue is the violation of the microcirculation. So with any our treatment, we are going to stimulate microcirculation. So we are interested in the or like we are not interested in the constriction of the vessels, which can be caused by the topic anesthetics. That is why I don't recommend to use it. First of all, I think it's not very effective, to tell the truth. So if you have a patient whose pain barrier is very, very low, so for them everything is painful, then this topic anesthetic will not help you. But it will cause the constriction of the blood vessels, which we are not interested in. So I don't recommend. And this treatment is not painful. So for someone is like, okay, they are doing something in their phones, they are not even paying attention to this treatment. For someone it's not very pleasant, but it's not a threat, not a big problem for patients, even for sensitive patients. For the capsules, can we stop taking after 2-4 months? Because sometimes patients don't want to take very long. Yes, we are recommending to take them 2-4 months. Then you can do break for 2 months and you can start using them back. Or this can be just 2-4 months for the complete treatment. And after, your patient maybe don't need to use these cups because everything is fine and you've solved the problem. Sure, it's not obligatory to use them whole year round. How to clean the scalp area before starting, especially if the oil is very oily. So first of all, you have to ask your patient to come to you after washing head, after washing hair. Then you also can use chlorhexidine. For example, I'm using chlorhexidine with or without alcohol. It's not very important is it inside, but you can spray it to the cotton pads, and then you can just touch it in the area you are going to inject. So any kind of area you are going to inject before you are touching it with the cotton pads with chlorhexidine. Minoxidil usage is effective, but when stop used, the hair loss will be fast more than before. Capexil is the same. So it can be the situation like I was explaining about androgenic alopecia with the men. So there is no evidence, there is no clinical trials which will show that in the case of Capixil it would be the same, but we just have to understand that for the patient with androgenetic alopecia, if the reason of this activity or level of androgen is not solved, the problem with the high level, the problem with the 5-alpha reductase of this activity, of course, when you will stop using any kind of minoxidil, Capixil, or any suppressor of the 5-alpha reductase, the problem will return. But I cannot say if it would be even worse than before. I didn't notice that after the stopping using of hair loss, we have more hair loss than we had before. And there is no clinical evidence on PubMed or in some official publics. Are there any cases we must take cream before we start the management? For example, patients with DM, what kind of cream you are talking about?
Maybe it's dermatosis, DM.
It
No?
depends what kind of dermatosis. So if we have dermatosis and you suppose that this is the reason of the hair loss, we should treat dermatosis like a reason. And only after we will think about, do we really need mesotherapy or no? This is the same which we have, like we've discussed about the anamnesis. Before understanding what is the reason of, for example, alopecia areata or alopecia caused about the scar in this area. So you have to evaluate it and understand if it's a scar, there is nothing will help, no mesotherapy, not hair lotion, nothing, because we don't have hair follicles. Talking about any kind of dermatosis, then of course, if you suppose that if this is the reason of alopecia, first of all, you have to treat this dermatosis. I am Dr. Sofia from Yemen, a plastic surgeon, and a lot of patients come to hair transplantation. So wanted to ask which better and faster. And I have other question. I have weak and thin hair in temporal areas as genetic, I think. What is your advice? So my advice, I suppose that if it's in temporal region, only in temporal region, then to tell the truth, it can be both. Especially if you think that it's genetic, it's more about androgenetic alopecia, then I would recommend you to use, first of all, hair loss control, but also you can use like combination. You can do one treatment with hair loss control and the next treatment of hair vital. And you can do this protocol because it will help you to suppress the activity of the enzyme 5-alpha reductase, and it will help you to stimulate the growth of the hair with the help of hair vital. And also, I think that hair lotion, you will love it. Even I usually do not recommend my patients to use hair lotion together with mesotherapy. So from my point of view, the effect of hair lotion is really very, very high. So I recommend them to use hair lotion after the sessions of the mesotherapy, because it's really very, very strong. So you can combine hair vital with hair loss for 8-10 sessions, and you can use hair lotion for minimum 2 months, but you will see very good results, and maybe you will use hair loss like for several seasons, several times a year, like 2 times a year, for example. And another question that you asked is about hair transplantation. That is actually a great question. So there are a lot of patients who are coming to aesthetic doctors after surgeons. And of course, it would be very good to stimulate microcirculation, to stimulate growth factors which will stimulate the growth of the hair, and of course again suppress the activity of the 5-alpha reductase. So after hair transplantation, I guess that in around 3 weeks you can start the process of the mesotherapy treatment, and it really will work great after the transplantation.
Mm-hmm. Anastasia, I have a question also from Mohammed from Libya regarding the cream that you should use before the sessions for the patients that have diabetes mellitus. Is there anything that we should be concerned about?
We should be concerned about that because if it's diabetes which is not compensated, let's say, so the person, like it's like the level of glucose of the blood is high, it means that we have to we have to evaluate, can we do mesotherapy or not? Because the main risk here is not that we will be not effective. The main risk here is that the process of the wound healing for such kind of patients is completely different than for the healthy patients. That is why this is always the risk of inflammation. This is also so the risk that every time that the patient will touch this area, again, the risk of inflammation. So from my point of view, if a patient has diabetes mellitus and if the level of the glucose of the blood is high, it's better to use hair lotion, it's better to use hair cups, but not to do mesotherapy. Not because of the product, but because of the processes of the healing. Also, as we've already discussed, diabetes mellitus can be the reason of the hair loss. So until you will not get the consultation of the endocrinologist, of the main doctor who is treating this patient, until your patient will not balance the level of the glucose of the blood, you will just don't get the result after your treatment. So it's crucial, and first of all, we need the consultation of the endocrinologist here. So
in one session, how many milliliter of hair loss we can use as a maximum dose?
So we can use maximum 5 milliliters, just because I think that you don't need more. Usually it's enough to use 2.5 milliliters also. So the quantity that you have in one vial is the quantity that you need for the treatment. But if you really have very significant areas of the alopecia and you want to work in this area in a more active way, so you don't want to inject like one injection per square centimeter, but you want to do point by point technique and to inject more product, or you have a patient with let's say big area of the scalp. So it depends with the patient, it depends of the area of alopecia, and maximum 5 milliliters if you want to do like extra active treatment. But in average case, 2.5 milliliters is enough.
Okay. So yes, I think we have no more questions. If you have more, you can write to your distributor. Thank you very much for being with us, Anastasia. Thank you so much for this wonderful webinar today. I think it was very, very interesting. I think now everybody will know how to treat successfully the hair loss thanks to you. So
and we'll start to use hair lotion by themselves. This is the first step.
Of course, this is the first thing.
And then you know how to recommend it, then it becomes your best seller. So it's usually the product which I really recommend to start with. I also would like to thank to all the audience today. Thank you for your interest, for your questions, for being with us today. And I hope that we will have the opportunity to meet during the live sessions of our lectures. So.
Yes, for sure. Also, I wanted to tell you that please be aware, because we're going to program more webinars about different skin disorders and about different techniques, also about the applications technique for the mesotherapy product that I think will be very, very interesting for you. So please be aware and stay in touch, and see you soon. Thank you very much for today. Bye.
Thank you. Bye. Have a nice evening.